You want to use a powerful drug to lower your patient's blood pressure. Esmolol is the key to that. My name is Leah. I've been an ICU nurse for 18 years, and today we're going to talk about Esmolol in this series where we're talking about ICU medications that we see in our drips pretty often. Esmolol is used for all kinds of things, but the thing that I personally use it for the most for blood pressure management is on our patients with aneurysms. So when they come in and we've got cardine, we usually have Esmolol on them too to keep their heart rate down and their blood pressure down. So you would use Esmolol instead of cardine, possibly if your patient's already tachycardic from something and you thought that could also bring down the blood pressure and the heart rate at the same time. But you would want to avoid Esmolol administration versus like a cardine for IV blood pressure medication. If you have a patient whose heart rate is already low, if they're already 60 and they're 60, 61, 62, and you start Esmolol for their blood pressure, they're about to bottom out. So you really have to stay on top of it with Esmolol because it does affect the heart rate, whereas like cardine and other calcium channel blockers really don't have that sort of effect that we see with Esmolol. The effects are really quick though. That's one thing we love about it. You put it on, it works real quick. You take it off, it works really quick. Other things to know about Esmolol is that you should not use Esmolol if your patient is already taking verapamil or cardizem. It'll increase the cardiac suppression, so you want to avoid it in that patient population. You are also going to not want to give Esmolol to a patient that is in third-degree heart block. I think that probably makes sense why, but you're going to avoid it in any type of bradycardia because it's going to cause more, but especially in heart block. You don't want to knock out what little bit they have left. Use Esmolol cautiously if your patient already has some renal failure or if your patient is in a decompensated heart failure situation. Honestly, with most heart failure, you're going to want to stay away from Esmolol. It's probably not your best drug if you have other options. Most places start Esmolol infusions at about 50 mics per kilo per minute, and you titrate for a blood pressure goal for that patient. Sometimes, like I said, you're going to be actually keep it at super low. Say it's like an aneurysm. They may be like, hey, keep the systolic less than 120 or 100, or hey, keep the heart rate less than this. So you might be titrating for that. Or if it's being used just for straight hypertension, it might be a more normal goal that you're using the Esmolol for. It could be like 140, but you're going to use the titration parameters that your policy and facility has set to keep your blood pressure under the systolic goal. That way, if you ever see it, you've heard about it, it's somewhere in the back of your mind. Watch the patient's heart rate, watch the patient's blood pressure, and follow your facility's protocol. So continue to follow this video series. Comment any questions you have. Tell me what you're seeing out there with Esmolol. I'd love to hear what your facility's doing. Are they using it a ton? Is it a drug you're super familiar with? Like this video and share it with a friend.